Hi, welcome to another episode of MYD Global. I'm your host, Leanne Hackman-Carty. One of the things that goes often underreported in a disaster is the mental health component. In this episode, I speak with Renae Beaumont. She's a faculty member at the York Presbyterian Hospital. Renae's done a lot of research in respect to helping youth deal with social anxiety, trauma, and giving them tools and resources to help. I talked to Renae about how this COVID crisis is going to impact us and what we can all use, whether we're young people or older people or people trying to manage those two age groups, as far as what we can do to help make sure that this is as smooth as transition as possible and what we can do in a proactive way to stay healthy. So stay tuned. Renae, how are you today?
Yeah, doing really well, thanks, Leanne.
Well, thanks for doing this. Before we get started on our topic, can you just tell the viewers a little bit about yourself, your background?
Yeah, happy to. So I'm an Aussie child psychologist. I'm currently based in New York City at Weill Cornell Medicine, New York Presbyterian Hospital. And my main area of interest and passion is really how can we use technology to boost the mental health and well-being of young people?
That's great. And so I know you're in New York right now, and as we tape this, your city's kind of been impacted by COVID, and you're not able to get around as easily as you were in the past.
Yeah, absolutely. I mean, it's kind of almost unrecognizable in New York City at the moment. There's hardly anyone on the streets. You know, kids are at home with families, not at school. Restaurants are empty. It's virtually unrecognizable.
Yeah. Well, I mean, the topic I wanted to talk to you today about was that whole mental health piece. Because when it comes to disasters, that is often something that is under recognized. I mean, people kind of just don't even realize what's going on until after the fact and the trigger events. And so I want to talk a little bit about disasters. And can you talk about kind of that mental health piece when it comes to whether it's other types of trauma, but disasters in particular?
No, absolutely. I mean, I think the first thing to recognize when it comes to mental health and disasters is that it's normal to have intense, strong emotions in response to a disaster, during and afterwards. So, you know, feelings of intense anxiety and worry about your safety, your health, your well-being, what's the recovery going to look like? But also other emotions like, you know, sadness and disappointment, particularly during times like this, you know, during the COVID epidemic or pandemic, where, you know, kids had events that they were looking forward to that have now been cancelled. So dealing with the sadness and disappointment of that, dealing with the irritation of being under each other's feet for long periods of time in, you know, a confined home environment where kids are trying to, you know, often engage with remote learning, parents are trying to get on with their work commitments at home. And also sometimes boredom, right? Like keeping yourself occupied and engaged. So intense feelings during these times are very normal. I think, you know, where it becomes concerning is where those emotions are all consuming, where you're not able to function in any other way, or where after the disaster subsides and people are in recovery efforts, you're not able to re-engage in your daily functioning. You're not able to kind of do those jobs at home or in your paid work or for kids at school because your emotions are so overwhelming. That's really when professional help's needed.
Yeah, well, and one of the things I've been thinking about personally is you've got kids, and you mentioned that, you know, they're at home, they're in a new environment, trying to do their schoolwork, they're usually connected every day with their schoolmates, and right now they're not able to even, you know, they might see them physically or virtually on the internet, but they're not actually engaging with them. And then you've got on the other side of the spectrum, you've got, I mean, a lot of people over, whether it's 70 or 80, I've heard both kind of age groups, just saying, do not leave your homes. So you've got that isolation at that end of the spectrum, but also the kids. And so I'm just thinking, is there a difference between what you would recommend, some strategies for those two target markets?
That's a really great question. I mean, there are some real similarities in how to offer support to your kids or maybe older relatives, parents. But there are a lot of very important differences as well. So I think the first recommendation or tip I'd have is, being there to talk to them about this. The worst thing you can do is avoid it, don't discuss it, because they're going to be exposed to lots of information about this in, their daily life through media, social media. So have those conversations, share accurate facts about what this is. But how you do that is going to look different for a child versus, an older parent. So one of the big important points when you're talking to young children, for example, about this is to share information in a way that's sort of age appropriate. Don't be oversharing either in terms of these facts and information that's beyond what they can understand, because that's just going to overwhelm them. The other thing in terms of how you share information with kids versus, older parents is the risk. The research we have around risk. So for younger kids, you can share with them, look, if you were to get this, you may feel a bit unwell, but you're not likely to be really, really, really sick. And that's sort of what the research to date suggests. Whereas for older parents, particularly if they're in ill health already, that risk profile looks a little bit different. So that's an important difference. The other thing which taps into what you just mentioned is you may be at home living with your children. So, you're there, you're easily accessible. If they have questions, you want to be able to answer them. And just know, hey, if they've got any questions, concerns, I'm here to talk to. But particularly if you have older parents who are in a care facility living alone, there's not that day-to-day interaction. So you have to be very mindful in terms of reaching out. And whilst text and messaging is so popular nowadays, often going that extra step of making a phone call, or, if they're a little bit tech savvy, a FaceTime or some sort of video conferencing call, so they can feel connected and supported. And engaging kids to do that, giving at a time like this is so important, not just in terms of helping other members of our community, but helping with our own well-being, as well as, staving off a bit of boredom as well. So I think, that idea of being there for each other, staying connected during times of social isolation, but how that looks can be different for younger people in your family versus older members.
Yeah, no, that's great advice, because I know a lot of people are struggling with what to do. I mean, all of us are struggling with, what we're seeing and what we're hearing and how our lives have been disrupted. And so then when you're trying to help those that depend on you, having the right approach is really important. I know one of the things that you do in your actual day job is really look at those technology pieces and how they can enable and help people deal with anxiety. Is there something you can kind of share on some of those things that you're doing that are you're actually, whether it's testing or whether you're using to help people with this area?
Yeah, I think first of all, I'd love to share some tips on things that are readily available to people to help them during this time. And then I can talk a little bit more maybe about some of the research I'm doing, the projects I'm involved in. So, one of the other things, coming back to your previous question around how do you help members of your family cope during this period? One is being a good role model, and that can be really tough because there's going to be times when all of us are like, wow, this is a lot to cope with. And part of being a good role model is showing, hey, this is how I'm coping with these big emotions at times where we all maybe feel a little bit overwhelmed. So coming back to your technology question, I think, there are some great apps out there like Headspace, Calm, Smiling Mind, which are meditation apps. And, there's a lot of research nowadays as to the value of meditation, even if it's just 10 minutes in the morning, 10 minutes at night, to be able to help with reducing anxiety and improving your overall emotional well-being during difficult times like this. So it's wonderful that those apps are readily available. You can get them from the App Store and online to be able to help you to cope and keep your mind sort of in a healthy space during times like this. The second, technological innovation that has huge potential and impact during crisis and during disaster times is telemedicine and telehealth. So, I'm no longer able to work with the kids and teens and young adults that I typically see face to face in that capacity. But, through innovations like Zoom teleconferencing and other video conferencing platforms, we're still connected. I'm able to offer them the professional support they need during times of uncertainty, where for people who do have mental health conditions, this can be a high risk time for those conditions to get worse. So I think that's another really invaluable technological innovation during times like this. Telemedicine, video conferencing, video support, even people who are showing some early physical signs that may or may not suggest that they have COVID. I know a lot of general practitioners are now turning to video conferencing in this time of social distancing to still be able to provide support and guidance without putting, populations at risk through a lot of face-to-face contact. So I think, in terms of the current situation, they're two technological innovations that have so much power. When it comes to, sorry, you go.
No, go ahead.
When it comes to some of the sort of technologically innovative research that I'm doing, I developed a video gaming-based therapy program for kids, particularly with anxiety disorders, ADHD, autism spectrum disorders, that teaches them the skills they need to feel sort of calmer, happier, braver, to make and keep friends, called the Secret Agent Society. And in the wake of Hurricane Irma in the British Virgin Islands a couple of years ago, I had the great privilege of being able to train educators and other mental health professionals in how to use this video game that kids find really fun and engaging to help boost their coping skills during a time of tragedy like that, but particularly in the wake of that, when it took quite some time for schools to get back up and running. And, kids saw their families struggling. So, it's great to see innovations like that. We're also working on a project looking at the power of virtual reality to reduce social anxiety in teens. And so, teens being able to practice skills of how they'd interact with a virtual avatar in situations like a cafeteria environment or a party environment or asking a question in class. Being able to practice those skills in a virtual world initially with avatar characters can really boost their confidence and skills to then put those skills into action in their daily life when they need them. So, the power of technology to help us during times like this, I think is really profound.
That's awesome. Well, I will include some of those links and organizations and resources that you mentioned in this video. And before we wrap up, is there anything else, Renae, that maybe I didn't ask you about that you would like to share before we sign off?
I think, at times it can be hard to find the silver lining in a situation like this. Like, we all probably feel like we're struggling, taking life day to day, problem solving on our feet in the moment, trying to figure a way to keep moving forward and help those we care about most. And I think sometimes it's during a situation like this that we can take a moment to reflect on what's most important to us. We're forced in some cases to be spending more time with family and connecting with close friends and loved ones, but realizing, that's often a value very close to the heart of many of us. So this is a time that we can use to promote that sense of closeness and connectedness with the people we care about most. And also to reflect inwards, like taking some time to kind of connect with what are your real values and priorities. Sometimes we get so caught up in our to-do list of all the social activities we've got to get to, and taking a moment to reflect on, hey, what really matters to me most? And this is an opportunity for that. I think also we're reminded, we see how this pandemic has spread globally so quickly. And this is a reminder that we are all interconnected, that we need to look out for each other. And when it comes to things like, healthcare policy or paid sick leave, it sometimes takes an event of this magnitude to hopefully promote positive change on a more global level in those areas. So I think it's really hard when we're in the eye of the storm to kind of think, what's the positive of this? But there's some things that hopefully may be positives that we can take from this experience.
That is a great way to end, because I know if you get consumed with what's going on and you're looking at the news, it's so doom and gloom. You just feel like, is there a light at the end of the tunnel? And so to be able to step back and say, you know what, this too will pass, and I need to take care of myself and my family, and just do what I can do, what I can control. So
Absolutely. Yeah.
That's awesome, Renae. Well, thank you so much for taking the time. I know you're going to be very busy, well, now and in the future, with a lot of important work. So thanks again for taking the time.
Thanks so much, Leanne. It was my pleasure to connect with you.
Okay, bye-bye.
Bye.